Hello, everyone, and welcome back to the Functionally Enlightened podcast. Today, I am so honored to have Kay Robbins with us. Me and her go way back, and actually back to the alma mater days. We went to the same university. We actually pledged the same sorority. So shout out to all my sisters from Lambda Tau Omega. And but our relationship kind of went beyond that because Kay was actually the woman who helped me bring my second child into the world. So I always hold her near and dear to my heart. But going to why she's on our show today, just as many of our guests, she's a highly skilled clinical nurse specialist and the visionary founder of Pure Alchemy Wellness. With over 12 years of experience, Kay is dedicated to enhancing health and wellness through personalized, evidence-based treatments. At Pure Alchemy Wellness, she empowers individuals to optimize their well-being through a comprehensive approach that combines cutting-edge therapies with holistic practices. Kay's passion lies in helping clients achieve sustainable vitality and age gracefully. So thank you again, Kay, for joining us on the show. Can you start us off by letting us know, we know of your experience, your extensive experience in medical world and in conventional practices, but how you branched into the holistic practices?
Of course. So Sharon, thank you for having me. Super excited to be here. And like I told you before we were recording, we have a very special relationship, I feel like. So what brought me into the wellness field is kind of twofold. I've always believed in transformative power of combining evidence-based practice, because that's a cornerstone of clinical nurse specialist practice, with personalized care. And as myself and my husband, we started aging, and the friends around us started aging, we started looking for ways to incorporate the knowledge base that I had from inpatient nursing into the wellness space, and how to manage some symptomology that we were experiencing. And then also looking for ways to increase longevity. And so that's how I got into the wellness space. And so the personalized care aspect and the transformation that we've experienced along this journey, I wanted to share it with everyone around me. And so that's kind of where we got to opening the clinic and where we're at now.
Awesome, awesome. So with your clinic, what type of modalities do you offer?
So we offer IV therapy. That was the cornerstone, the initial basis for opening the clinic. And from IV therapy and looking at some of the evidence and literature that's out there, we've kind of branched into more longevity solutions. Still IV therapy, vitamin injections, wellness testing. So we offer like micronutrient testing to be able to tailor and personalize the IV therapy that we're administering. We also do kind of life coaching and our personalized care plans and treatment plans with the patients, which includes supplementation based off of lab work. We either draw or we get it from their primary care physician, and we kind of look at all of those things together, along with lifestyle choices, workout plans, their meal plans, and kind of put all of those things together to create a tailored approach. With the longevity side and longevity solutions, we do have some partners that we've partnered with for supplementation. One being Novos, because they do a lot of research, and their supplements are natural based, either found in nature or found in our bodies. So we've incorporated that with the NAD IV therapy or NAD injections, along with biological age testing. And so all of those things together give us a better idea of what we're doing on a cellular level and how to better treat you, not only to make you feel better, but we want everybody to live longer and healthier lives.
Yeah, that sounds beautiful. I know that they're saying with the proper cellular enhancements that we can expect to live more along the 120-year time period. Like that could be an
Yeah.
expectation. But with the way we are now, with today, the standard American diet and everything that we're exposed to on a daily basis, we're seeing our ages maybe reaching in the mid 70s, low 80s, and those are like far reaching now. So I'm glad to
Absolutely.
hear about your protocols and the way you're looking at the holistic aspect of things. I'm wondering about the any of the chronic illness community. Do you see any of the demographics where people are probably dealing with something beyond 6 months time frame where they really are needing that nutrition component, especially?
Yes. So about 30 to 40% of our clients do have some form of chronic condition. And usually whatever chronic condition they have is what brings them to us in the first place. So we have two very different subsets of clientele. We have the clientele that's really health conscious and they want to focus on maintaining their health. And then we have the clients that come in that are dealing with the symptomology from their underlying chronic conditions. And so those patients usually have autoimmune disorders, are dealing with fibromyalgia pain, and it is interfering with their daily functioning and therefore their overall quality of life.
So tell us a little bit more about metabolic syndrome. What does that look like to your clients who are coming in?
So the two metabolic conditions that I see the most in the clinic are diabetes. You're talking about the pre-diabetes. The lab work that is off, but it's not considered like full diabetic, usually as a result of some other condition that's linked, like PCOS, for example. PCOS can cause a lot of insulin resistance and can affect your glucose levels. So when your labs are drawn, your labs are coming back not in like a diabetic or pre-diabetic state, but they're not completely normal, like they're kind of teetering on the high end. So those type of conditions, and then also obesity is considered a metabolic condition. And so people are coming in with higher BMIs, and that would be classified as obesity, but because of the society that we currently live in, it's not abnormal to see those BMIs anymore.
Right.
And so those are the types of clients.
So some of these markers that you just mentioned, the glucose, the HbA1c, and the insulin. So we're used to seeing things, even people in the around the 10 mark for insulin, for instance, and they wouldn't really be flagged in conventional practice. But if we're seeing in the functional realm, what would be the cutoff point for you where you're starting to look at that being a concern with insulin resistance?
So it really depends on the rest of their medical history and their lifestyle. So I tend to look at the lab work kind of more on a overall rather than just the number. And it's the same thing for when people are their lab work comes back abnormal for cholesterol levels. That's another one that's creeping up there where you're not considered hyperlipidemia yet, but it's also not in a normal range. So I don't have a specific number. Long-winded way to say I don't have a specific number.
Right. And it's very true how it's very bio-individual, and people come in, like you mentioned, the cholesterol panel. I, for instance, have cholesterol that my total cholesterol is pretty high. Triglycerides are great. LDL is a little bit high, but I am on a ketogenic, very GAPS oriented diet. So I know what I'm bringing in is not the culprit behind that. So like you said, we would look at overall lifestyle, other things besides diet, and see, for instance, there might be some toxic exposure, there might be parasites in the gut, there might be just dysbiosis overall. So you did mention one of the things that I always like to look at, and that's the micronutrients. And it's pretty, it should be standard. It really should be, but we're only looking at a certain amount of minerals when we're doing the comprehensive metabolic panel. I'm getting all the acronyms kind of switched around at the end of the day. But yeah, so we're looking at things besides just sodium and potassium, for instance. What are the things that you're looking at when you use the micronutrient panels?
So when I use the micronutrient panels, I'm looking at one, the levels that I'm able to supplement via IV therapy, because that is the most efficient way to deliver high doses of nutrients directly into the bloodstream. Looking at that first to see what levels are off and what formulations and also what dosage I would need to input in their IV. And then I'm also looking at, for the things that I'm not able to give in the IV, what is the interaction between those vitamins in the body so that we're able to modify diet. For example, diet has a lot to do with the results and the interactions and how much your absorption for your vitamins are. And then part of the metabolic panel that we use, which one is it? It's SpectraCell? Yeah, it's SpectraCell.
Hmm.
It gives you that aging difference, and it also tells you where you're at in reference to the rest of the population. So I look at those graphs and I like to go through the lab results and just show you. And then with micronutrient testing, I think it's important to get baseline testing to initiate treatment and then to get follow-up testing so that you can see the changes in your levels.
For sure. And how far apart would you space those testings to see, well, first take us to a protocol. You develop a protocol for someone, you give them IV, like a individualized IV protocol, right?
Mhm.
How often would they come in for treatment? And then when would you retest?
So we would get the baseline. Most people, it's sufficient to only come in once a month for an IV. Um, some people come in twice a month, every 2 weeks for IV supplementation, but at least once a month, generally sufficient, especially if I'm infusing high doses. And then we would do that for 6 months and retest at the 6 month mark.
Okay, that sounds good. So I'm gonna throw a couple of case studies at you per se.
Ah.
Hopefully you don't mind. If you have a client who is maybe has lower ferritin, lower percent saturation, and they're having symptoms like chronic fatigue, maybe they have. We'll say this is a female. Maybe she has pretty heavy menstrual flow. What would
Mhm.
you do for her? And because I've seen so many people try the oral route with supplementation and they wind up developing additional symptoms like migraines, or they're not able to fully absorb and assimilate that oral
Mhm.
vitamin.
So oral vitamin, oral supplementation is not efficient in my opinion, and it's for a couple reasons. One, because all your oral supplementation is going through your gut, and
Mhm.
so your true absorption rate is only probably about 30%. Second, most people are taking their supplements at the wrong time or the wrong way. So ideally, like if you're taking a multivitamin, for example, your supplement that you're taking should be in conjunction with a meal and it shouldn't be on an empty stomach. And a lot of people, when they come in and talk to them about when are they taking their vitamins, take them in the morning, at night, on empty stomach. It's most of the time I take it when I wake up. I have my coffee in my hand, and that's it. Your body's not prepared to absorb any of that. There's nothing in your system yet. So it's probably not the best time to take it. But as far as the patient with the heavy menstrual cycles, she's probably deficient in iron and is experiencing symptoms from that. So IV wise, B12. I generally recommend B12 to most people. And so B12, when we have bleeding or heavy menstrual cycles or any other disorder that's going to affect our red blood cells, even dehydration, because the amount of hydration you have affects your red blood cell levels, and it can affect your lab work too. B12 increases the oxygen carrying capacity for your red blood cells. So if you are losing a lot of blood, then it's helping at least improve that hemoglobin and the oxygen carrying capacity in your blood. So it's decreasing the symptomology that you have. So when people take B12, that's why they experience that increase in energy, and it becomes more sustained. So that would be one vitamin that I would recommend for that client. And really, it depends on how deficient she is and whether or not I would recommend supplementation with iron.
Mm-hmm.
Um, Iron infusions are kind of a little bit different beast for IV clinics. It's not like a typical protocol. It's a little bit of a different protocol. But it depends on that patient, whether or not I would recommend an iron infusion. And iron, when you go to see the doctor, is usually recommended orally. But then with that, you have all of these side effects like hard stools, and you have to take a stool softener. It's just like compounded and compounded and
Right,
compounded.
right.
And what was the rest of her?
Yeah, no, I think you pretty much addressed it because what is important here is that some people don't tolerate the oral supplementation. And
Mhm.
and then as you mentioned, it's a whole different protocol when you're looking at certain vitamins, if you're looking at minerals, if you're looking I don't know what other practices you do there, but I'm thinking in terms of long-standing, again, chronically ill people, stepping aside from
Yeah.
that case study. So people that are experiencing dysautonomia, orthostatic hypotension, or hypertension, like one way or the other. I know in my
Yeah.
case it was hypo, and I was getting biweekly infusions, and they were just giving me general sodium. But there's probably now something called a banana
So what?
bag.
Yeah.
Yeah.
So wait, what infusions were you getting? Were you getting iron or were you just
No, no,
getting
no, just
sodium, like
sodium.
just regular fluids?
Yeah, just regular fluids biweekly. And that helped to a certain extent, like it prevented the syncope, but it was more like maintenance. It was just barely managing the condition at that time.
Yeah.
Yeah, so I'm wondering what would be something you would do. I know you're going to look at the entire, all the lab work that they have available, and most of the time, they just come with whatever primary care has ordered, sometimes with specialist labs, maybe cardiac panels, cardiac workups. But for people who have dysautonomia conditions where they are basically limited with mobility, they're having all of this severely disabling symptoms happening. I can't even right now. My brain is not working. Maybe that's one of them. Brain fog is usually a pretty big symptom in that population.
Brain fog. Okay. I know I'm going to sound like a broken record. When I'm looking at the vitamins that I'm recommending for people, there are my two top winners, which is NAD plus. I recommend NAD plus for everybody and for the majority of conditions. There are a few conditions where we can't do NAD. For example, cancer patients that are currently in chemotherapy, we can't do NAD for them. But once they finish their treatment, then we're able to start treating them with NAD. And NAD is my number one because it's so highly studied and there's so much literature on it. And it really does help with so many conditions. And it's like just the superstar. Um, the second one is glutathione.
Mhm.
Glutathione is a master antioxidant. It helps with skin, helps with hair, helps with energy, it helps with liver function. It just works very, very well in the body. The other one is B12 and our B vitamins, the B complex
Mhm.
together.
Yes.
If you get a B complex, then you're hitting the majority of your vitamins except for B7, which is your biotin. That's not part of the B complex, but you're hitting all of your baseline B vitamins that you need. And when you couple that with vitamin C, everything generally tends to work better. So the Myers cocktail is the IV typically that has all of our baseline vitamins in it. And so that is a good starting IV to ensure that we're hitting all of our basic bases. So that has B complex, some additional B12, vitamin C, magnesium, calcium, then of course the sodium from the fluid.
Yeah, that sounds pretty comprehensive. And I know I've heard the Myers cocktail many times. I myself have not received it surprisingly, but that's something that I should consider making a
When you come
routine.
here, you gotta let me drip you.
Absolutely, yeah. So I'm thinking for the audience who's not really too familiar with NAD, could you let them know again what it is, what it stands for, and where where it's most applicable?
Yes. So NAD, it helps with things linked to cellular dysfunction. And aging, for example, is a cellular dysfunction. At the basis, the 12 things that lead to aging of our bodies, of our cells, are cellular and cellular functioning. So NAD stands for nicotinamide adenine dinucleotide, and it's a coenzyme. And so it's critical for our cells to use for energy production, DNA repair, and cellular rejuvenation, which is why NAD in the wellness sector is generally talked about for anti-aging and increased energy and brain fog and mental clarity because it works on all the cells in the body to help reverse or halt where we're at right now with the aging process for them. And so NAD is naturally occurring in your body. And so when you're young, you have a whole lot of energy. But when you start getting older, it naturally declines as you age. And then it declines even more with the stressors that we put on our bodies. So any chronic conditions we have, fatigue, stress, our lifestyle, all of those deplete the NAD that we naturally have in our bodies even more. So that's why we utilize NAD with supplementation so
Mm-hmm.
that we're able to increase those levels that we had while we were younger, or before we were sick, or
Right.
before we did all the things to decrease
Mm-hmm.
those levels.
Right. And it's this society we live in, the hustle culture where we're depleting just with stress alone. So
Yes.
that's something I see routinely. And then we always build it into the dress for health success protocol is what we call it. So diet, rest, exercise, stress reduction, and supplementation. We can't leave any of that out. So I like your holistic approach. I love the fact that you even build in like the physical component of trying to get people back on track into wellness and longevity. So what are the other things that you do? You've developed a protocol, you include specific IV protocols for them, right? And then
Yeah.
what are the other things you do to help them along while they're out of the clinic?
So, oh, sorry. So I developed treatment plans, which include their treatment plan not only for their infusions. Sometimes we incorporate injections in between the infusions. You're most effective at maintaining your levels, depending on which infusion you're getting. If you include injections in between, they can do those injections in the clinic or their home injections, where I teach them how to do the injection. We do the initial one here, and then they're able to do those at home, so they're not coming back and forth all the time. We look at their weight, their diet, and then their overall lifestyle. And so we incorporate all those things into a plan. I do have some meal plans that I'm able to provide some clients, and then also some workout plans so that we're able to, again, complete that whole picture.
Yeah, that's wonderful. With the people who are highly sensitive, I'm not very well versed in how they tolerate the infusions, but have you seen anyone come in maybe with mast cell activation disorders or anything like that where they've been unable to expand their diet for many years even? And you know that they're pretty cautious in terms of oral supplements that they've been taking. They're taking things at like single ingredient at a time.
Yeah.
How would you approach helping them navigate their healing journey?
So we would do it slowly. They are not a patient that I'd be able to do a Myers cocktail on. We would have to individually supplement, um, probably through injection and do one at a time. So we would start with some of the nutrients or the vitamins that have the least amount or the least risk of having a reaction.
Mhm.
And then we would just gradually go on from
Mhm. A lot of these clients, they do have either if they're approaching you, they've already probably exhausted
there.
all of the
Yeah.
other conventional practices and they haven't seen any real
Improvement.
right. And that's the what's the word again? It's just disturbing that, it could be years before they find a practitioner such as yourself where you can offer things that are going to be utilized by the body appropriately, right? And
Mhm.
just the educational piece isn't out there enough for them to know and to approach it from the beginning. And I'm
Yeah.
guilty of that too. It took me 3 years of my journey where I was just kind of going around in circles with all of the different specialists, getting piecemeal recommendations, prescribed antidepressants, proton pump inhibitors, and nerve, what is it? Like gabapentin for the nerve pain. And then I was prescribed a series of things for the mast cell activation, and nothing was really addressing any of the symptoms. And in actuality, I found myself more symptomatic. I've developed things like hyperhidrosis. Like,
Oh,
why
yeah,
was,
because
yeah, it
of
was,
all the different things that you're taking, because everything was piecemealed.
yes.
Nothing was comprehensive. Yeah.
Right. So practitioners like you and I, where we look at things holistically, and I love the fact that, your type of clinic exists today because, like I mentioned, some people are not able to orally tolerate, nor not even just, even if they do take it, maybe the gut is in so much distress that they're not going to be able to process and break it
Absolutely.
apart.
Mhm.
So tell us a little bit about how nutrition really happens when they're receiving these infusions, like for the in layman's term for us.
In layman's term, nutrition happens because we are bypassing your digestive tract completely bypassing it. The nutrients are delivered directly into your bloodstream, so you have a near 100% absorption. We're delivering it right to the source.
Right, right. And then the organs can utilize what they need, and
Mhm.
I guess the liver would process what it
Yeah.
doesn't and excrete it similarly, like it would have to be through our urine excretion, right?
Yeah. Hmm.
Okay. So that makes sense. Our listeners come from dysautonomia community, implant illness community, and some of them may have found help, right? They've had explants and they've already started the detoxification process, but they're not getting to that level of functionality that they really want. So how could you guide them, or what kind of tips would you have for them so that they can reach that next level?
So they need to find somebody like you or I, that's going to help them reach that next level. A lot of people, especially when you're going through a chronic condition or feeling bad for so long, or you've lost so much of your daily functioning, um, in your way of life, it's really easy to get lost in the
Mhm.
process, and to feel overwhelmed. So my first one is to maintain consistency and to seek out a community, a holistic community that's gonna guide you through the process and look at all the different things going on in your life, a holistic practitioner, if you will, and working hand in hand with them, you'll be able to maintain the consistency, and hopefully overcome what you're going through right now. I actually don't have a really good.
I think when I'm looking at your background there, your clinic, it throws me back to when I was receiving the infusions. And I remember before that, I was always go, 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 not physically because I was pretty immobile, but in my mind, I was always trying to figure out what was wrong, what can I do, what triggered this last episode. So I'm looking at your environment there, and I remember when I got the infusions, I would be there for 4 to 5 hours, sometimes a little
Yeah.
bit more. And that was actually a time to sit back and relax. Mind you, sometimes I had some textbooks or some other literature to read while I was there, but it really drove home that we need to stop. We need to take time for ourselves. And I imagine when people come to see you, that's what they're experiencing too.
Oh, yes. Now that you put it in that way, absolutely. A whole person healing is a real thing. And the interconnectedness, not only of your body and your physical symptoms or what you're feeling physically, it's your mind and your spirit and emotional. So that's kind of, now we're talking about the space, what I had in mind when I was creating the space. With the relaxation, the aromatherapy, we use biofrequency patches to help realign the energy in the body too. So yeah, remember that yourself is a whole self, mind, body, and spirit, and to take the time to rejuvenate that and to treat that. And that is going to help your physical self too.
Yeah, absolutely. So thank you for reminding me of that. I know still when we start getting into a better situation, or we can say becoming more functional, we kind of revert back to what probably brought us into the chronic illness community to begin with. And,
Mhm.
you know, if I rewind the time leading up to my disability, I know that I didn't allow myself the opportunity. And I love that now we have spaces like your clinic where people can go in and they're looking at well-being in general. They don't have to be ill, but they know because of our chronic exposures to air quality, water quality, and to toxins in our food, they're one step ahead by giving their body what it needs to be able to detox efficiently on a day-to-day basis. And so
Yeah.
what you said here, that you don't necessarily have to come in every week or every 2 weeks even. What you're doing here is something that sustains them for a longer period of time. So can
Yeah.
you just before we close up, can you let us know um, how that process works in terms of how is the duration? Like what causes it to be able to be so sustained?
So it is the dosage for one, the amount that you're able to take in when we're delivering anything intravenously is so much greater than the amount that you're able to take in orally or even through the muscle through injections, because there's only so much a muscle can take and absorb effectively. The same thing with anything orally. So the way that it's sustained is the dosage, the amount that I'm giving you, and then also the route, because so much of the nutrients and the vitamins are bioavailable, then they're able to be better utilized and to be stored in the areas that they need to be stored for longer periods of time.
Mm. Yeah, that's very encouraging, especially with things, we can't cross the blood-brain barrier too easily with things. And so you're bypassing that limitation. If
Mhm.
there's stuff we're ingesting, it's not quite getting where we need to. And I think with dysautonomia and other conditions, there's a lot of neurological symptoms that arise. And so I'm imagining that everyone who has some type of neurologic condition would benefit from direct infusions like this, or anything else you offer that the injections that they would do. And I'm not sure what types of injections they could do at home versus what they would need to come see you for. So maybe you can just briefly touch up on that.
So most injections are able to be administered at home, as long as they're the injections that you can give subcutaneous rather than IM form. But to ensure that you're doing it right, you know what you're doing, it does require a clinic visit. So I offer that to established clients that have their plan in hand and have been in the clinic with me to know how to do the injections. But most of them you're able to administer at home.
Okay. Yeah, if they have the fortitude to do it. I know some
Yeah.
people, they might be a little bit not scared, but what's the word there I'm looking for? A little hesitant to
Yeah, and
self-administer.
some people don't like needles at all.
Yeah.
They don't want to see the needle. They don't want me to tell them that it's coming. So we talk and we inject them and then it's done. And so some people just like to come see me, which is fine with me too.
Yeah, yeah. I think that that's another important piece, because when you find a practitioner that you can be open with, that that they're going to listen, that makes a huge deal. That's a huge impact to their healing too, because they've been brushed off so many times before. So I appreciate what you do for your clients, and I am looking forward to coming for a visit one day and
Yeah.
getting getting your best IVs that for my particular condition, because I know you take that deep dive into each
Like, you know,
person.
we're gonna have to look at all the things, Sharon.
Before we leave off, can you let our listeners know how to reach out to you, where to look you up, and maybe to learn more about your resources?
Absolutely. One thing I didn't mention was where we're located. I'm realizing that now. So we're located in San Diego, California. So if you're local in the area, the surrounding areas, you can look us up on your Google Maps and we'll come up. Otherwise, our website is purealchemywellness.com. All of our socials, TikTok, Instagram, Facebook, purealchemywellness.com. And then the number is 424-372-1600. It's also textable.
All right, perfect. And we'll be sure to include that in our show notes. And again, I thank you so much for joining us today, for sharing the information. This is something definitely that I'm just starting to tap into. So I've learned a lot today.
Good. I'm so glad. Thank you for having me.
All right. Thank you to you, and thank you to our listeners. We'll see you on the next episode.
Bye.